And I think what happened is that was my weak area, and I didn't really know. I was young. I was feeling great. So I was running, which is really hard on the pelvic, the spine, and I was running a lot. And got down to that size 6, was thrilled, went away, had my vacation, came back, kept doing all of this great stuff until one day I fell off the treadmill and was carried to the front of the gym by 2 very elderly men that shouldn't have been carrying me, probably. One of them ended up being my client. But then ended up going to the chiropractor and, did the shaking of the head and telling me, this isn't good, Tiffany. It doesn't look good. You'll be in a wheelchair if you don't do this many chiropractic treatments. You'll be in a wheelchair by the time you're 55. I was 34. Anyway, Amber said to me, I think I called her after a few weeks of doing it, and she said, "How are you feeling?" And
actually, I remember precisely.
I don't remember it.
I called Tiff up. I was all excited because I had taken maybe the 2nd or 3rd module of Bowen training. All excited. I'm like, Tiff, and we lived next door at the time too. Tiff, I need guinea pigs. I need case studies. Would you mind? Would it be possible for you to come over to my house because I need a body to work on? And she was like, oh, you know what? I would love to. I wish I could. It's just that I screwed my back up and I have to go to the chiropractor. And she knew how much Bowen, she saw me have my life saved by Bowen. I don't think he considered that maybe me being a student could possibly actually help her. Maybe lack of confidence, whatever. And I didn't have much confidence at the time either. And I said, well, could you at least give it a try? Like, I'd worked on lots of different cases, but as a student of Bowen, you need to get your hands on some people that need the help, so that you're doing it properly to help them. So we did. And I laid in her living room, and on the little 2 to 4 minute breaks, Amber was folding laundry, and we had kids running around us, and I'm thinking, what the hell is she doing? Like, this is crazy. You go, girl, you do what you want to do, but my God, like, this is going to work. I think I'm going to miss my chiropractor appointment if you don't hurry up.
But I felt this interesting sensation, and I mentioned it to her straight away, and of course she got out all her books. I said I felt this jiggly, jello-y feeling was how I explained it in my low abdomen, which would be where all the scar tissue from my C-sections was, which I thought was kind of weird. And I got it, using treatments every time. And it was my body repairing that area. Also, my pain was low back, really bad sciatica. And so I can speak to all of our clients who may be seeing this who don't follow our rules. I was a big rule breaker. Amber told me all the rules. Drink lots of water. I did it. I drank more, but I didn't drink enough. And don't run. Whatever you do, don't run. And she, told me that you can walk, you can do this, you can do that. Don't run. So like I said before, we lived beside each other. And I used to go out for my walk, and she'd go, "You're not running, right?" And I'd go, no, I'm going for a really good walk. And I'd get back around the corner where she couldn't see me anymore, and I'd kick it into high gear and go run, a good 10 kilometers. And guess what? I woke up that morning feeling great, and the next morning after my run, it all came back again. So after doing this for a few weeks, I never said I was the brightest. I learned that I was going to try and follow the rules, and it was incredible. And then I had a bout with Bell's palsy. Months later or something. Yeah. Bowen resolved that without Amber even getting to the protocol that is specifically for it. Just my body responds to Bowen. I'm a junkie. I love it. And she's helped me with for my kids, chronic nosebleeds for my daughter. She had her nose cauterized at 3 years old. She doesn't really get nosebleeds anymore. It's amazing. So Amber was opening up a clinic, and she asked me if I would be the manager because I had a lot of customer service and office skills. And I think it was within about, 3 days of seeing people come in just limping and, walking an hour later, getting up and going, "I don't know what you did today, but I feel so good." And, we had tears in the clinic, all of us. And I'm like, that's it. That's what I got to do. I've got to do the same thing. So I got into training almost immediately. It was...
Yeah, I started the training right away, and it was meant to be because then I got pregnant again.
And then I got certified right before Amber went away. It was wonderful. Goodness. It's helped so many people. We treat so many people in a week and are amazed daily. At least once a day, I sit back and go, God, he was a genius. I don't know how he figured this out. He was a genius.
It's a gift from God.
Absolutely.
That's how he figured it out.
So that's what we...
Yeah, it's pretty cool stuff.
So those are two fantastic stories, ladies. Now, I think I'm getting a little better at explaining this now. So what I just want to do quick is, before we finish up, just summarize it again in layman's terms, because I have heard this I don't know how many times, and I still want to make sure that I have it correct. I get the treatment part. You go in, for about an hour-long treatment, and the practitioner is in and out of the room, correct?
Mm-hmm.
Okay, so the practitioner comes in.
Yeah, you got it.
Does their moves, which is, how long are you in the room for each time? Approximately.
Not as long as a lot of people would like.
Really, 1 or 2 minutes, really.
And the client's laying on a massage table, blankets. I mean, it's very relaxing, comfortable.
Which is why I probably imagine a lot of people think that it's not doing anything, right? Because you're coming in and doing such subtle movements and then leaving the room. I imagine the skeptics out there are thinking.
Yeah, me too.
Yeah. Okay.
Yeah, they're laying there thinking that they're wasting their money, and yeah.
Yeah, it is. It's subtle. But I think it gets back to the basics. It's simple but complicated at the same time, I guess.
Right.
I think it almost seems too simple, but you know what? It works.
Yeah. Well, the easiest way to convince somebody is to talk to somebody who it's worked on, and everybody knows somebody that this is worked on, so they're the ones that.
Yes.
Yeah.
It's incredible word of mouth, because
right.
not many people have anything negative to say.
Exactly.
It
yeah.
is.
And everybody brings their mother, they bring their father, and that happens weekly, daily.
Yeah, that's right. And there's always such a good energy in the clinic when you've got that skeptical person that's coming in. They're scared, they're in pain, they don't need more pain, and they sometimes hear there could be a small increase in pain. And you get that one person in there, and you can tell they're sort of looking around, because we've got such a great little clinic. The energy in there is just amazing. And you get that client who sees them, and they understand them because they were that person. And they talk to them, and they start this conversation. You have to cut the conversation off so you can get this person back. But they've now passed on their personal experience. We get that a lot.
It's almost like AA. I've never been to AA, but it's like the people that have been through recovery, they know what it feels like to be the new person, and they're not sure if they like it yet. So it's so nice. Our clients are really,
we've got great clients.
Nice to one another.
Yeah.
Because they feel so good now. You know, you see them come in, and of course they're a little bit grumpy. They've got sort of a negative energy about them, and
they're pain.
We understand that. You know, and I think all the practitioners that let it heal, just let it roll right off them if someone's a little bit short with them or whatever.
Because we see the transformations too. It's interesting, the transformation. I had a lady the other day who said to me, she's coming to me for treatments. Her daughter came a year ago, I think, had really good results. And, you know, regardless of her pain, her mother was laying down on the table and she said, you know, I've got to say thank you because, and I can't use names, but she said, I started to see my daughter come back. Since the accident, I lost her. And it brought more back than just less pain. It brought a passion for life and vitality and that inner child thing, whatever it is. It brings your life back in lots of ways.
It makes it worth living again. That's what these people have lost the will to live. I think if you ask them, a lot of them would say, oh yeah, if I had the option of just dying right now, it would be better than enduring this pain.
Yeah.
Because it robs you of your life. You've got no patience for your family, for your friends, some people can't even go to work when they're in that much pain. It's horrible. It's true.
Right.
So yeah, it's good stuff.
I think I've almost got it here, ladies. I have one more question though. Is it for all ages?
Yes, absolutely. We newborns we've done.
Yeah, we don't charge a cent for babies.
Babies are free. We love having them.
They come in, whether they've got colic. A lot of people will assume that their baby's having colic if they're crying all the time. In some cases, it's actually a neck restriction, which the average mother wouldn't be able to diagnose at all. And actually, we're not allowed to diagnose either. We just fix it. But whatever it is with babies, they almost always correct within a couple of treatments.
Very quickly.
I'm just thinking about what that would do for the divorce rate if everyone had access to this.
So true.
Colic is really hard on a marriage.
Absolutely.
It's really hard on the working parent as well as the one that's stuck home with the crying baby. And just think if the first 6 months of that child's life were a positive experience rather than just, being an imposition on everyone. There's a whole bunch of stuff you could read into that psychology-wise too.
Yeah.
Of course these babies get all the love that the parents can possibly muster up, but if they weren't crying 24/7, there'd be a lot more love to go around.
And I think a lot of people forget the trauma of birth. I mean, it's horrible on the mother, it's horrible on the baby. Think of their head. Anyway, so that's the youngest.
Yes, that's the youngest.
And the oldest, well, there's no limits.
There's
the
no
oldest
limits.
person I've worked on
They
is
have
like
to be
98.
breathing. They do have to be breathing.
Okay,
we can
ladies.
still
Follow the
treat
breath.
them.
We could treat them. I don't know if they'd notice any
Probably
improvements.
wouldn't get any results. No.
So when you're not
Just one of those things.
when you're not in Cancun, we can reach you at the Burlington location, but you also have 4 other locations. Is that correct? We sort of were trying to work that out
We've got
earlier.
stores. What'd you say?
We're
Kitchener, St. Kitts, Dundas, and Toronto.
okay.
And of course, the website is letithheal.com. All the information is there. Also, I work for the Bowen College, which is the only school in Canada that is accepted, their curriculum's accepted by the Canadian Examining Board, which is making it a lot more acceptable by insurance companies. It's not always covered under insurance, but it's getting to be more and more. And we're hoping that eventually we'll get some more clinical data that'll support it even more. I'd love for OHIP to cover Bowen. Doubt if it'll happen, but at this point, people can learn Bowen even if you don't have a history in any sort of body work. It's a matter of contacting the Bowen College, which is www.bowencollege.com, and you can check out their curriculum there. I'm one of the instructors. I generally teach in the Burlington-Hamilton area, but probably be going to Guelph, Waterloo in the summer as well. So it's really fun to learn. You don't have to commit to the entire curriculum. Some people just like to learn it so that they can help their family members feel better. You know, if you've got someone that's elderly, that always has aches and pains, or a child that has spinal problems that's just always going to need treatments, or asthma, whatever it is, it's worth learning the technique. I think Tiffany needs a treatment right now because she's now on marble.
Okay, ladies.
Yeah, so that's the Bowen.
Thank you.
I know
so
we got to wrap
much.
up. Eh?
Yeah, we're gonna wrap up here. So Amber, you'll be back next week hosting the show.
Yeah, I'm coming back next week, and we're going to be speaking with Christine Ng from No Sugar Please, and we're going to be talking about allergies.
Perfect.
And she's going to share her system with us, how she works on allergies. I can't remember who else I have coming on the show, but there will also be other people.
Okay, well, you're on
They'll be
vacation,
nice.
so that's allowed. Thank you very much, ladies, and we'll see you next week on Let It Heal Live, Amber.
Have fun.
And yeah, thank you for covering the show for me too, girls.
Absolutely.
Great job.
Yeah, you guys did awesome.
No problem.
Okay, have
Talk
a good
to you
one.
later. Bye-bye.
Okay.
Buenos
Bye.
dias.
Buenos dias.
And thank you, Amy, for joining me
Thank
today.
you.
It helps
It
a
was fun.
little with the whole.
We should have been there, but
Yeah, exactly. Not being in Mexico thing. So yeah, we'll see Amber next week on Let It Heal Live. If you'd like to tune back in, that'd be great. And we'll hopefully I'll be back on the show as well as Amy. We've been on a couple times now, so we're rather enjoying ourselves. So thank you very much and have a wonderful afternoon.